Hello and welcome to the COMLEX Instant Review. Let's review cholangitis. This is an infection of the biliary tract secondary to an obstruction that leads to biliary stasis and bacterial overgrowth. Again, cholecystolithiasis accounts for a big chunk of cases for cholangitis. And the other causes include pancreatic and biliary neoplasms, invasive procedures like ERCP, and cholangitis is actually potentially life-threatening and you need emergent treatment. The diagnosis is made mainly by right upper quadrant ultrasound as the initial study, and there is the common Charcot's triad, which is right upper quadrant pain, jaundice, and fever, and it's the classic triad seen in about 50% of all cases, and Raynaud's pentat, which is Charcot's triad plus septic shock and altered mental status. And again, understand that the lab values will show hyperbilirubinemia, leukocytosis, mild elevation in transaminases, and getting a cholangiography through a PTC or an ERCP is beneficial, and it's the definitive test. Also, understand that once cholangitis resolves, you want to proceed with ERCP to identify the underlying problem and plan the proper treatment. You want to perform a PTC when the duct system is dilated and the ERCP when the duct system is normal. So that's a key difference for the boards. You want to remember those 2 points there. Right upper quadrant ultrasound is very accurate in detecting gallstones and biliary tract dilation, but not very accurate in detecting common bile duct stones. So what's the treatment here? Well, IV antibiotics and IV fluids are key, and close monitoring of hemodynamics such as blood pressure and urine output. And again, you want to decompress the common bile duct via the catheter drainage and perform an ERCP or a laparotomy through a T-tube insertion once the patient is stabilized. So that was a review of cholangitis. Please visit comlexflashcards.com for additional podcasts, and good luck in your preparation.